Hi everyone, I'm Dr. Sidnee Chong, a TCM physician specializing in women's health. Today, we're diving into PCOS, Polycystic Ovary Syndrome, not from a fertility lens, but from how it affects your everyday health. If you're dealing with acne, irregular periods, or feeling overwhelmed with symptoms, you are not alone. And there is hope. In Western medicine perspective, PCOS is a hormonal disorder. The core features include irregular or missed periods, elevated androgens, which is a male-type hormones, multiple small cysts on the ovaries seen on ultrasound. What is androgens? These are testosterone, DHEA, and androstenedione. When you're too high, you may notice some symptoms like acne, excessive hair growth, scalp hair thinning, or even changes in mood and sleep. In the lab work, you may see LH and FSH ratio imbalance, high free testosterone, elevated AMH, and insulin-resistant markers. In TCM, PCOS is seen as an imbalance. Traditional Chinese medicine see PCOS not as a one-size-fits-all. We see patterns instead of diagnosis. So common TCM patterns that we see are phlegm and damp accumulation, which includes weight gain, fatigue, and irregular cycle. Qi stagnation, which brings mood swings, PMS, and breast tenderness. Yin deficiency, which brings insomnia, anxiety, and very light periods. In stasis-wise, we see period pains and dark clots. So we believe that when qi and the blood are not flowing properly, the body cannot regulate hormones. So PCM is seen as the deeper symptoms of imbalance. Let me share a case study that I have treated in a clinic. This is a 42-year-old woman, non-fertility with PCOS. She has no weight gain, but severe acne on chest and her back. She has elevated testosterone, and she's highly stressed. She also has irregular cycles. In TCM, diagnosis is qi stagnation with heat and blood stasis. So the treatment plan includes using acupuncture points to clear the stasis and herbs like luperin, mint, and tangui. For her diet, I advise on cooling and anti-inflammatory diet, and lifestyle includes movement, breath work, and screen breaks. After 3 months, she has significant acne reduction, regular periods, and less stress. For herbs and acupuncture, it is very helpful to combine both of them. The common herbs that I use are peony or bai shao, which regulates the blood and calms the liver, tangui or angelica, which nourishes blood, Fuling resolves damp and supports the spleen, and Changzu to clear damp and phlegm symptoms. Of course, herbs must be prescribed based on your constitution by a licensed practitioner or a TCM practitioner. For acupuncture points, I use spleen 6 to harmonize reproductive organs, stomach 36 to boost qi and blood, and liver 3 to smooth liver qi. Burn 4 and 6 are both combined to regulate the uterus and hormones. So here are some diet suggestions. Avoid dairy, refined sugar, and fried foods. Include leafy greens, whole grains, and flaxseed, chia, and seaweed. And some tea suggestion would be like spearmint tea, chrysanthemum tea are both very good. Prioritize sleep before 11 p.m. And movements such as Tai Chi, yoga, or walking are very good. Do journal and write down any stressful thoughts and manage stress every day. So PCOS doesn't have to define your life, whether it's acne, fatigue, mood swings, or irregular cycles. Your body is asking for help and to balance. Through traditional Chinese medicine, we aim to regulate not just symptoms, but your entire system. Thank you for watching and subscribe if you like more videos like this. And leave a comment if you are navigating PCOS or have questions.